Each human being is unique and different. Each one of us arrive in this world with our own set of inherited traits. These traits are often a blend of our forebearers, but they are not necessarily an exact copy of any one person. A shy and quiet mother is amazed to find that she has a loud, aggressive, and argumentative child. Born of the same mother, two siblings could be in exact contrast of each other despite having the same upbringing, the same diet, environment, social status. Even twins may be diametrically opposite each other. Temperament is our inborn, God given nature. They take form according to our genetic material. If we had few statues of Dr. Hahnemann, one made of gold, the other made of alabaster, the third made of plaster of Paris, the fourth made of gold, the fifth of silver, all of them would be statues of Dr. Hahnemann. But the raw material inside would be different. The raw material, friends, is actually to be considered the temperament. That is the difference between gold, silver, clay. Whereas all the statues, the look constitutes the personality of the person. Never confuse temperaments and personality. Temperaments and personality differ like this. Personality is what you are in the boardroom, and temperaments, friends, is what you are in your own bathroom. Friends, research on temperaments must have started 400 years BC by Hippocrates, where he would call this as blood, yellow bile, black bile, and phlegm. In 149 AD, Galen named it as sanguine, choleric, melancholic, and phlegmatic. The same temperaments was then thereafter continued by Dr. Hahnemann and furthered by Nair, Clark, Fleury, inclusions in the complete repertory, Robin Murphy's repertory, and thereafter even by David Little. When we were in college, friends, one of the books which we all have used and used to date is The Keynote and Characteristics by Dr. Allen. If we open the page pulsatilla, we read there, adapted to persons of indecisive, slow, and phlegmatic temperament. In contrast to that, when I read under the same book, Lachesis, I find it says persons of a melancholic temperament, dark eyes, and a disposition of low spirits and indolence. Women of choleric temperament. In college, our knowledge of temperaments was only limited to just this and nothing else beyond that at all. It is only later on that when I did my study on temperaments that I realized what temperament was. Temperament, friends, is the characteristic combination of bodily, mental, and moral qualities which together constitute the character and the disposition of an individual and predispose him to act and behave in a particular manner. Where is it that we have temperaments included in our organon? It appears under aphorism 213 footnote, which says, thus, aconite will seldom or never effect either a rapid or permanent cure in a patient of a quiet, calm, equable disposition, just as little will nux vomica be serviceable when the disposition is mild and phlegmatic. Pulsatilla, where it is happy and gay and obstinate, or ignatia, where it is imperturbable and disposed neither to be frightened nor to be vexed. Friends, let's have a look at this video.
Human beings are very expressive. They laugh at a joke. They cry when hurt. They think about themselves and also about others. They seek revenge when they are angry. And some sing a song when happy. Some talk about things, tell stories, while some listen to others' worries. Many are proud of their success, and some jealous of others' progress. They can be someone's best buddy and even the bitterest enemy. Some agree with each other, and at times opinions differ. Man is a rational animal, but understanding him is not simple. Different people have different temperaments. Temperaments play a big role in influencing our day-to-day behavior.
Friends, there are basically 5 temperaments: choleric, nervous, phlegmatic, melancholic, and sanguine. My research of temperaments is probably now about a 20-year-old study. After 10 years of intensive studying and putting it to use for patients, we brought out a book called Temperaments, a Study. And then followed by that, the same knowledge was used and converted into a software which is now available as Tempraz along with Zomeo. Friends, explaining each temperament in detail would be a long and exhaustive study. However, in a nutshell, if I were to tell you, melancholics are people who are sensitive, who are sacrificing, who are extremely courageous. They are perfectionists, responsible, and they are very trustworthy. The sanguine people are generally people who are full of life, love to party, they have no grudges, they're very optimistic natured, very friendly and amicable, frivolous, heedless, and humorous. The choleric are competitive, dominating, they are leaders, impatient, they are very, very organized, they are independent, they are very witty. The phlegmatic is an exact opposite of the choleric. They're very relaxed, very yielding, extremely contented. They are stable people, very peaceful, very happy with what they have in life, don't mind a routine life. They are couch potatoes. The nervous people are those who are extremely anxious. Everything and anything can make them anxious. Because they are very anxious, you will generally find all of them pre-prepared for any event or even when they have to give a speech. Health is a major, major concern for nervous people. They're very punctual, and because of their anxious nature, they are also overcautious. This is just in a nutshell to tell you of the different temperaments. Friends, I would like to share with you a case with a pronounced pathology of how I treated it through temperaments and how I used it at every step. This is a case of primary carcinoma of the breast with subsequent pleural and bony metastasis and cervical lymphadenopathy. Mrs. ABK, a 75-year-old female patient. She was brought to me at the clinic. She was not brought to me rather at the clinic because of her critical condition. The history given by the daughter were with the following words: "We are only looking for relief from distress of our last few moments." Here, there was no question of treating it. It was only palliation that the relatives asked for. Her presenting complaints was persistent cough since 2001. This lady never goes to the doctor. She self-medicates. She would guzzle up bottles of cough syrups like Corex and Benadryl in indiscriminate doses. Cough with severe hemoptysis started in the year 2006. Cough which prohibited her from talking. She had a sensation of tightness in her chest, pain in the lower lips, sleeplessness because of cough, breathlessness which was aggravated even if she was walking about in the house. The other associated complaints were lack of appetite, nausea which was aggravated from strong smell, urine with ineffectual urge, offensive, incomplete evacuation of bladder. She was diagnosed, to give you a whole idea about how the problem began. So her main problem began in the year 2003 when she was diagnosed with left-sided breast cancer. In the year 2004, in January, a left mastectomy was done. The surgical pathology report shows invasive ductal carcinoma, grade 2, grade 3. 6 cycles of chemotherapy were then administered to this lady. This is the report, the mammography report. A closer look shows a mass lesion in the retroareolar region of the left breast is suspicious for a malignancy. There is involvement of left axillary lymph node as well. This is the surgical discharge card of the lady who was operated for her CA breast in that particular year. The surgical pathological report showed left breast invasive ductal carcinoma grade 2-3. The diagnosis, as you see, it was nipple free. However, left axillary lymph nodes metastatic ductal carcinoma. The surgical pathological immunohistochemical assessment also showed us that she was estrogen receptor positive, progesterone receptor positive, and Herceptin negative. How did this all happen? Origin, duration, and progress. So, persistent cough, which was better after she took chemo, but unfortunately, in 2006, she had a recurrence of some symptoms. In December 2006, she started experiencing bouts of breathlessness, which were worse when she was walking about even a small distance, accompanied with weight loss and loss of appetite. The chest and abdomen ultrasound showed right-sided pleural effusion. In January 2007, fluid tapping was done which showed metastatic malignant cells. Friends, thereafter, repeated tapping was done almost every 15 days and 4 cycles of chemotherapy were given. However, the oozing did not stop and her pleural effusion continued to recur. CT scan of March 2007 shows no changes in pathology, so the drug was changed to 2 to 3 cycles per month, so no change was seen. Finally, chemotherapy was discontinued and this lady was finally sent home with a pigtail catheter in situ, and the daughter was advised to continuously keep draining the fluid after a few hours. However, in July 2007, the pigtail catheter had to be removed because the fluid inside was very thick and it was not possible to aspirate, and the doctors found that it is getting secondarily infected further, so it's best you stop all modes of treatment. The patient continued to be on oxygen, very clearly conveyed that she had just a few months, a few days to go. And it was at this juncture that the lady consulted us to help her only palliatively because she knew for sure that mother wouldn't survive for a long time. The X-ray and the CT scan show big lumps inside the pleura. All treatments were stopped since then and the doctors gave her just a few months. This is the USG guided pleural effusion report which shows metastatic malignant cells from a breast primary. This is her immunohistochemical assessment once again, which shows metastatic malignant cells from a breast primary. CT scan of the chest reveals, this examination reveals evidence of large pleural effusion with multiple pleural deposits on the right pleura. This is again a radioisotope bone scan which shows an increased tracer uptake in the left humeral head, which is suspicious once again for metastasis. This is again the CT scan which shows right pleural effusion with multiple enhancing pleural based nodule, highly suggestive of pleural metastasis. This is her alkaline phosphatase and proteins report. Once again, the PET CT image which shows evidence of active disease in multiple CT demonstrates pleural based lesions on the right side. This is her CBC, where I'd like to highlight that at this point of time, when we began treatment, the patient's hemoglobin is 8. CT scan of the chest shows increase in pleural effusion from previous CT study, no significant changes from the previous CT. This is somewhere around the time that the treatment was commenced. This is X-ray, and you would be able to appreciate and see that there is a pigtail catheter over here in situ for the patient, and it is at this stage that the patient was asked to go home and discontinue with the chemo. This is the X-ray report. Let me now take you to the physical generals. Appetite fine, thirst more for aerated drinks, loves Fanta, feels better after that. Craving for spicy food, but that causes acidity and burning in the chest. Sweets, milk, preparations, dal, and aerated drinks. Aversion, very fussy eater, dislikes rice and dislikes vegetables. Gets loose motions often, occasional constipation. Loose motions alternates with constipation. No perspiration, sleep very bad, takes rest till at night. Thermals can tolerate heat better now. Obstetric history. She has 3 female children. There was complication during one delivery and she almost, in her words, bled to death. Her family history shows cancer in her paternal aunt and past history of recurrent diarrhea. Very interestingly, almost verbatim, I will try to tell you what the history was given by the daughter because I never saw the patient. She said, "My mother is aware that she has cancer, but she has not registered the seriousness of the disease. Though she is so sick, she believes all is well with her health." And mind you, this is a lady who every time she went to the doctor, if the daughter wanted to speak in confidentiality to the doctor, would refuse to leave the room and say, "I need to know about my illness, I'd as well be here." And she would ask the doctors questions herself about her problems. Despite that, there was just no seriousness about her disease. She ran a pickle business, and every time and when she had this particular problem, she decided that all the material that she would use for her pickles, she would stock it up properly so that in the next season she would be able to use the same material again well. And she wanted to inform all her clients that this year she would not be making pickles, but next year onwards she'd be back in rhythm, when she knew very well and she was told by the doctors that she had only few months to go. She gets very angry if things don't go her way. She is not a compromising lady. She would not bend or try to accommodate others. Though she would understand the opposite person's point of view, but still she would stick to her guns only. She was always very critical, even when she was healthy. Very sturdy, extremely hardworking, but very fault finding. She could never manage with any house help. She could never manage with a cook because if the cook came into the kitchen, she would stand there to supervise how it was, find some fault or the other. Finally, the cook and the house help would get fed up and leave. When she was very sick, the daughter says, "I forced her to stay with me as I had to aspirate the fluid and take care of the general health. However, when the doctors said remove the pigtail catheter, it is useless, she made it very clear to me that she wanted to move to her flat in the next building. Much against my wishes, she chose to stay alone and she refused to give help." These all points are, friends, characteristics of the patient which we need to quickly pick up. Every homeopath needs to always have the speed of a panther and the eye of a hawk. Whenever a symptom is mentioned, seen, or observed, it has to be quickly picked up and noted because these will be the points which will form our prescriptive totality. She is a very difficult person to stay with. She prefers to stay alone. She refuses to acknowledge that she needs help and does not like to be dependent on others. She lacks humility, will never say that you took good care of me. Rather, she would say, "I don't need you all at all." She dislikes any advice coming her way. Just tell you how strong the lady is, despite of having CA, despite of having breathlessness and a few months to live, she wanted to be her own independent self. My father passed away 12 years ago. For a few months she was affected, but thereafter she came out of it quite quickly. He was a very calm and soft person. She would be the one to argue with him. She is very aggressive as compared to my father. She's always agitated over trifles. If we listen to her, she'll be very good. But we assert or to try and put our point across, it'll be something where it'll trigger her anger and she'll be really, really angry. My mother was outspoken as compared to my father. However, when it came to important decisions, my father's word would be final. She would try to argue, but being indecisive, finally she would give in. She was never a strict mother. In fact, when the daughters would scold their children, she would try and tell them that this is not the way to conduct children. She never hit us. She is not at all systematic. She's a very messy person. She's very independent, stubborn, and very hardworking. She's very shrewd. In the daughter's words, she says, she can make ice in Iceland and sell it to the Eskimos. So she would make pickles. She would have small samples and she would send the samples across to her friends and associates. And then she would ask them the next day, call up and ask them, how did you like? Naturally, people would say, oh, it was really nice. The next word immediately would be, okay, how much would you like to order? In plain, she was really very outspoken, extremely hardworking natured lady. She had only studied till 10th standard. She used to work in a multinational company as an operator. Ours was a big family, and my father's pay was not enough to supplement us. My mother was the bread earner of our family, and she loved to work. However, I have never known her to be an ambitious person. She worked in the same position, doing the same mundane job for years together, despite her ability to be able to secure a better job. She loved making friends. She had a big group of friends in office. She was helpful to her friends. She would be the first one to reach a hospital if anyone was ill, carrying food for relatives waiting outside the ICU. However, the paradox was that if we daughters are in difficulty, we do not receive the same treatment. In fact, one of her daughters ran into some marital issues and she decided that baggage she would go and stay with her mothers. The other two daughters were very happy that mother will be now taken care of because now this sister will be moving in with her. The mother welcomed the daughter who had the problem but made it very clear, this is my house. I stay here. You are welcome for a few days. But after a few days, if you don't wish to stay with your husband, you will have to make your own set of arrangements. With all daughters married, she had no responsibility. She had no stress, no tension, and she led a happy, lonely existence, friends. It is at this time that I decided that I would give this lady Crotalus horridus. Why? Because Crotalus horridus would cover her malignant condition, the hemorrhagic condition, the antipathy that she had to the family, and her suspicious and mistrustful nature. Let me run through the follow-up date-wise. On 30/7/2007, she was staying with the daughter and she had this pigtail catheter inserted which daughter had to aspirate periodically. We gave her Crotalus horridus 31 dose. Hemoptysis persist and she was then given Crotalus horridus 201 dose. At this point of time, I have not used any knowledge of temperaments because at that time, even I felt that I was only trying to help the patient to make her death easier. This, as you see, is the X-ray of the patient. And what it says is, once again, right lung metastasis suspected, right dome of the liver. I really do not see any change post Crotalus horridus being given to this lady. The other thing that happened is the hemoglobin, if you remember, friends, which was 8, now dropped to 5.7. Time for me to say, take a call, change your remedy. So then, friends, I have repertorized this whole case just as any one of us would do with any one of our patients. So I had about 25 rubrics here with me: fault finding, sensorial, irresolute, independent, intolerant of contradiction, quarrelsome, sympathetic, objective and reasonable, heedless, careless, estranged from a family, rudeness, desires routine work, industrious, deceitful and sly, audacity, defiant, ambition, loss of. Now, at this point, friends, I would explain to you that when I picked up this particular study and this particular research, which now, of course, comes as Tempraz, what I did is that I decided to be able to understand patients better. We decided that we must have, if we know that a particular patient has a particular symptom, for example, in this lady, we do pick up that this lady is extremely sensorial and critical natured. So what I did is I went to the rubrics from different repertories and also found out how this particular word would be represented in form of rubrics in different forms, in different repertories. And that's how we constructed a particular template whereby we have different Tempraz words, the main features which are described by the patient as a friend, what a friend thinks about that person, how he is as a family member, what is he at work, what would be his positives, in other words, his assets, and what would be his negatives, in other words, the liabilities. I will just go on with the case and explain how I have used my system thereafter. So just as you see over here, I have used sensorial, and under sensorial over here, you are seeing different rubrics from different repertories. Similarly, the next that I have taken is say, not so attached to a family. You will not find a rubric not so attached to a family. But if you know a person is not attached to a family, what are the different rubrics you could choose is or are once again over here. So you have 13 more rubrics from which you could choose, and it could make a difference in your perception. It could make a difference in your case taking. And based on these rubrics, you could ask for more clarity from your patient and thereby choose the most appropriate and the most fitting rubric for that particular case. Now here initially I thought she was very shrewd and astute, but then I found, because here I have given words which look alike and each word has got a different set of symptoms. So under manipulative, you will see that these are different set of symptoms again over here, and from here you can choose once again the right one. Taking it a little further, so how do I summarize this lady based on the words that I have decided to choose? So she's audacious, she's not so attached to the family, she's lenient, she's messy, she's compassionate, opinionated, egoistic, obstinate, refuses advice of others, not so ambitious, quarrelsome, intolerant of contradiction, independent, indecisive and irresolute, critical and sensorial. Now, friends, if we go to this and if you will click the button, then what I get here is that there is a temperament quotient of this person, and her temperament quotient shows that this lady is highly choleric with a count of 66 and phlegmatic with a count of 32. Of course, this calculation is based on an internal evaluation by the expert system. This, friends, if you remember, were the same 25 rubrics which we had taken earlier, and we had some 445 remedies. And out of these 445 remedies, now I will try and use the filter here. And as I use the filter based on and choosing only predominantly 11 symptoms, physicals and mentals included, they are egotism, disposition to contradict, desires cold drinks, spitting of blood in the expectoration, constant cough, cough from talking, sensorial critical, contradiction intolerant of, industrious mania for work, audacity, and defiant. And here, friends, we use our till now we have not used any of the filters. You're seeing that the checkbox, the list over here is still not ticked. We are yet to tick it in the next list. Here, friends, I go further. And to my surprise of surprises, we see only two remedies now. And these two remedies are arnica and sulfur. This led me to study these remedies more. And friends, the final remedy that I decided to give this lady was, so as you see here, before I tell you that, I'd also tell you that I decided that since the temperament is a mental general, I wanted to use only physical symptoms and not use a single mental symptom in the whole thing, and then see whether I am able to get the same set of remedies. And so therefore, in this slide, as you see, I have only used symptoms, the physical symptoms, and I have just given a filter of choleric and phlegmatic. And as I give the filter, once again you will see arnica, bryonia, calcarea, carboveg, ipecac and sulfur popping up. The common between the two, as you see once again, is arnica as well as sulfur. So friends, I began with arnica 201 dose. Friends, let me share with you a few tips about arnica. Arnica, friends, is not just a remedy which helps physical injury. In fact, it is one of those remedies which tremendously helps people who are overworked, who have a financial loss, and those who have gone through a complete shock. It is very useful, of course, when there are falls and when there is blunt is injury by blunt instruments. I would like you to remember that arnica is one of the most hardworking remedies. In fact, they are so hardworking that they push themselves so hard, work themselves almost to death. They work as if there is just no tomorrow. They are people who are very independent, and friends, they are extremely opinionated. They want to stay alone. They want to manage life alone. They don't want your opinion. They're very dictatorial. They are very dominating. They want to have their own space. When they have a point of view, they will see to it that they try and convince you with their own point of view. They are very short tempered, very quarrelsome, can be really, really angry. Little things can make them fly into a temper. They are very courageous to the point of actual audacity. A very important point of Arnika is self-medication. I have always seen Arnika hates to go to the doctor. And because they hate to go to the doctor, they self-medicate themselves. In fact, when internet started with medical sites and medicines which were easily available and the advice easily available, so many of the Arnikas had given me the history that they would never go to the doctors because prescriptions were easily available. They almost knew what it is. They'd walk to the chemist and take the medicine themselves. So they think that they are well equipped to take the medicines. Even if a medicine is prescribed 3 times a day, very often Arnika thinks it's advisable to only take it once a day. And sometimes it may be a life-saving medicine, but despite that, they would continue to do that. I have very often seen that the sore, lame, bruised feeling is also seen in their mental faculty. When we treat patients who are semi-conscious, these Arnika patients cannot bear to even sleep in one position. They must keep changing their positions frequently because they are really, really just not comfortable in the position that they are. They never want a doctor. Says nothing the matter with me, and they drive the doctor home. They have a fear of being approached or being touched. I have very often seen in a lot of Arnika cases, there is a history of child abuse, there is a history of rape, and this mental injury scar seems to remain with them for a really long time. And in fact, this gives them the touch me not attitude, and they do not want to be touched, and they don't want anyone to even come near to them. Sometimes they even try to avoid human contact. There is a fear of being approached, there's a fear of being touched. Now, friends, just as we are able to find out the temperament of the patient, we similarly need to note the temperament of the remedies. So just as I gave you the initial few points, there are a lot many more about what a melancholic is like, what a sanguine is like. Similarly, in my study, what I did is I went to each remedy. I went to all the master materia medicas. And from all these materia medicas, what I tried to do is I tried to gather the symptoms pertaining to each of them. What would be the choleric symptoms from there? What would be the melancholic? What would be the phlegmatic? And so on. Then it was compiled. It was cross-matched with a reverse program done by the repertory, a complete research software for which we took help from Dr. Jawahar Shah. And the whole software was then constituted, and thereafter the whole research was collaborated through the repertory as well as the materia medica. And thereafter I was able to designate that arnica is choleric 3, nervous 2, sanguine 1, phlegmatic 1. And in support of that, we have over here, for example, arnica. What Hahnemann says about arnica is he's hypochondriacal peevishness, he's indisposed for everything, uncommonly peevish. Everything is repugnant to her. Everything annoys her. He contradicts. Is opinionative. No one can please him. Cross. He wants to quarrel with everyone. Herring says, naturally cheerful, kindly and genial, he became downcast and waspish. Says there is nothing the matter with him. Indifference to everything and morose. What Lippi says, irritable. Says very well when sick. Hemp bell. So in this way, this is the choleric part. The phlegmatic part. Herring says forgetful, what he reads quickly, escapes his memory, thinking tardy, slowness of thinking, inability to perform continued active work. Hahnemann says all work annoys him, is lazy for all business. So this is the phlegmatic part. Now, friends, on 18th, we began treatment in 2007. On 18 to 2008, the patient developed pain in hypochondrium with occasional hemoptysis. In between the Arnica 200 and the Arnica 1M, we have only continued with SL as the patient started doing really well. Arnica 1M was repeated at this juncture. On 19/4/2008, cough persisted, but bloody expectoration stopped. Is all geared up. Now, the pickle season in India starts at this time. So she says, all geared up to make pickles, and she goes to Masjid Bandar to get her ingredients. Friends, she decided to not even take a cab. She wanted to go by bus. In fact, friends, one day she was so much better by that time that she was traveling alone. One day she was standing at the bus stop where her son-in-law told her, "Why are you standing here? I will take you wherever you want." To which she refused and she said, "I know you are very kind, but I think I can manage on my own. Please go. The bus will come and I'll go by bus." On 15/9/2008, cough better, had loose motions, Arnica 1M 1 dose. I did not see the patient for the next 4 months because she felt better and there was no more need to spend on doctors. On 8/6/2009, she developed shoulder pain, Arnica 10M 1 dose. Pain in the shoulder better, appetite better, itching on the scalp, weight 50 kg, generally better, stays independently and has no troublesome physical complaints. On 20/10/9, pain in the right elbow, occasional dyspnea, weight 50.50, Arnica 10M 1 dose given. On again in February, eruptions on the arm, itching, no shoulder or elbow pain, weight 51.5, continued on SL. On 2/6/10, friends, it's 3 years from where we began, 3 years. She was given 6 months to live. Catch in the back, appetite normal. She got some pipples for the doctor to taste. Lives alone and independently. Manages her day-to-day life well without any physical complaints. No pleural effusion bothered her thereafter. Not a single tap was done thereafter. This is for you to see the X-ray. When we sent her back again to the pathologist with all the previous CTs for a comparison, he wrote back saying, in about 2.5 years, 2 lesions show complete resolution, 2 lesions show reduction in the size by about 33%. 1 lesion has remained unchanged. Friends, this is a lady who did very, very well, old lady. Despite the fact that she was 70 plus, she managed life very well and lived for a good few years, healthy life, and in which she even continued to do her business. Friends, let me take you to the advantages of using temperaments in practice. Temperaments, friends, to me is a mental general. Temperament quotient, as you saw, I used it as a filter and thereby I was able to reach Arnica with great ease. Reaching the most appropriate rubric with different choices given. As I showed you in the slide earlier, many a times in our routinistic practice, we continue to use only one rubric every single time for many patients. We do not sometimes give a thought that there could be a possible rubric which is somewhere near, but we have yet not explored. Hence, there are many more rubrics given which help us to choose the most appropriate rubric. Managing the patient becomes easier if you know the temperament. If you know that this is a patient with nervous temperament, you will be watchful of your words because every single word you speak will be recorded in their minds and further increase their state of anxiety. So you may need to watch your words. Even when you have to speak to a choleric, you have to watch your words because they will again confront you with different set of questions thereafter. So managing these patients, how you're going to talk to them, what is going to be the way in which you tackle the patient if you know the temperament becomes really easy. Understanding the patient's actions and reactions based on the temperament combination. For example, friends, if we had Nux vomica and if we had Lycopodium, okay, and if we had to differentiate these two remedies, friends, Nux vomica is choleric and nervous, whereas Lycopodium is a remedy which is choleric, phlegmatic, and nervous. And why the phlegmaticity? Because Lycopodium has got in it also cowardice, and therefore a Lycopodium will not be as great a physical fighter as possibly a Nux vomica would be. Understanding the remedy, its actions, and its reactions, with we would be able to differentiate each individual one from the other. If we have two individuals, the way in which they behave, their body language, the way in which they conduct themselves at work, with their family, all this can be understood. Better history taking can be done. You will have a three-dimensional view of the case, and thereby your prescribing will be complete with a complete totality. And friends, we are thereby also able to differentiate each remedy from the other, because we have materia medica, which I call as the Tempraz materia medica, wherein we have taken resort of so many books. And from each book, the different temperaments have been separated, segregated, symptoms segregated, and thereafter the materia medica has been constituted. So friends, temperaments has made my practice extremely easy. It has helped me in the most difficult cases, in cases where pathology is involved. It's helped me when I have only had physical symptoms and sometimes not much time to take mental symptoms. But if through the body language of the patient and a few words, if I've been able to conclude that the person is choleric and use those physicals and then take a filter, and then I'm able to reach the remedy with ease. Thank you very much. I thank Enlightenment Education and I thank Dr. Jawahar Shah. Thank you once again.
I have been using Hompath since the beginning, since almost 25 years, and I must say that this is the software which is always progressive in nature in terms of database, in terms of intelligent use of the various breakthroughs that are being discovered in the field of homeopathy. I am able to see that every time when I meet Dr. Jawahar Shah, he presents to us something very unique and something which is very useful. Hompath has been very user-friendly, and while giving a lot of seminars in many parts of the world, I have found the utility of Hompath extremely useful. And I must thank the team of Hompath for dedicated to the operative field of the science of